Welcome back to Inside South Florida. Heart Month may be over, but we should never stop caring about our own heart health. So here to share more insight is Dr. Tanya Elliott. Tanya, thanks so much for joining us today.
Yeah, thanks for having me.
Yes, let's dive right into everything. So tell us a little bit more. What is CoQ10 and how important is it to our heart health?
Yeah, so coenzyme Q10 is a compound that's essential for our muscles in order to make energy. And the highest concentration of coenzyme Q10 is in our heart, which is a muscle. Most people think, oh, my heart's an organ, right? No, it's a muscle. It needs to pump, right? It needs to be super strong. And coenzyme Q10 is essential for that. And it's also present in other muscles in the body. Now, coenzyme Q10 decreases as we age. We don't produce as much of it. And coenzyme Q10 also decreases when people are on statins. Now, statins are super important at lowering high cholesterol levels and reducing risk for heart disease. But an inadvertent consequence is it also lowers CoQ10 levels, and lots of people don't realize that. So that's an important thing to discuss with your doctor.
Speaking of discussing, you guys recently did a study with some interesting results. Can you share those with us?
Yeah, so Doctors Best conducted a study, their leading supplement brand, and what they wanted to understand is what are people's knowledge and understanding of their heart disease risk, right? 60% of the survey respondents didn't even know their risk for heart disease, which is fascinating to me and concerning because it is the #1 killer of Americans, and one person dies every 34 seconds from a heart disease related complication or a heart attack, right? The other thing the study showed is that 50% of Gen Zers, right, these are people under the age of 30, were worried about their heart, and stress was the #1 risk factor that they cited. And high stress levels were associated with fatigue and just generally not feeling right. And 17% of those Gen Zers who responded to the study were on a statin. So these are people under the age of 30 that are being treated aggressively to lower their cholesterol levels. So you know what? They have a right to be concerned. They are at risk for cardiovascular disease. They're being treated for it. And very few people who responded to the survey knew about the correlation between being on a statin and reduced coenzyme Q10 levels.
Well, I know that I definitely want to take care of my heart, and I know all of our audience, everyone everywhere wants to do the same. So what steps should we actually take to help decrease, our heart disease risk?
First things first is awareness, right? And understanding what's my risk stratification, right? Like, am I very high risk? Am I low risk? Am I somewhere in the middle, right? And then that can help determine the best therapy. So first things first is understanding your risk and having a conversation with your doctor. Are there tests available beyond just general cholesterol or checking me for diabetes or checking my blood pressure? And the answer to that question is yes. There are a number of other blood tests that can help better determine your cardiovascular disease risk. And there's also imaging studies that can help better determine your cardiovascular disease risk. So show up to your doctor as that informed consumer and ask for answers, right? The second thing is understanding this correlation between this important compound coenzyme Q10 and it being reduced when you're on a statin, and having a conversation with your doctor about whether or not CoQ10 is right for you. Also, one of the most common side effects of being on a statin is muscle aches and pains, right? And so being on coenzyme Q10 can help with those muscle aches and pains, as can reducing the dosage of the statin. So if you're experiencing side effects, again, have that conversation with your doctor. Lastly, I'm going to say strength training and physical activity, right? And eating healthy and the Mediterranean diet. But I'm going to just add one other aspect of that is to do it with your friends, do it with your family, your neighbors, and in the context of community. Because the biggest thing that I'm concerned about is social isolation and loneliness, because that's an independent risk factor for mortality. So use this as an opportunity to take a walk after meals with friends, do a healthy eating challenge potluck with your friends, take a strength training class with your friends, right? Do it within the context of community. I think we'll see better outcomes.
I love that, Dr. Elliott. Even community can be a cure for some things. Where can we go for some more information?
You could check out doctorsbest.com.
Awesome. Dr. Elliott, thanks again for joining us.